So we are going to assess my cranial nerve 1, which is the olfactory or smell of the senses. And I'm going to assess how my brain reacts to having some stimulus given to it that stimulates that particular nerve. So I could use a forward fold, but I feel pretty good there today, or a shoulder movement, or rotation. I think I'm going to use rotation because I feel a little stiff in my mid back today. So I'm going to put my hands together, fingers together, and I'm going to rotate reflexively. Just stop where I stop. There's a little gnome, garden gnome there. I'm going to stop there at the garden gnome, and here I'm at my first tomato plant. Okay? And then what I'm going to do, and I have in my pocket, I could use a couple things. Here we've got a little inhaler, peppermint inhaler. We've got lavender, and I know that it's lavender. If we were working together, I wouldn't tell you what it is. I'd see if you could guess, okay? But I'm going to use the lavender. I'm going to plug one nostril, doesn't matter which one. And I would ask you if you could tell what it is. Obviously, I know what it is, and if you could even visualize it, just to see how things are coordinating in our brain, okay? Take a breath. I'm going to go back to my original position, so I've got my fingers pointing to you, and then I'm going to rotate, and I'm all the way over to my peony plant. And then I'm going to rotate over here, and I don't know if you guys can see it, but I'm going way beyond peony plant, way beyond the gnome, and I'm at the pepper plant over here in the little planter. So what that just told me was that my brain reacted well. It liked that stimulus. And what it does is it gives me a gateway, so to speak, an opening to moving in that particular movement that I moved in. I could work in that area and train it with exercises to develop strength to access it in a better way, because it calmed my nervous system down. It liked that stimulus of the cranial nerve 1. And then I could also have assessed that same side of an upper body movement of some sort. I just chose to go with one nostril and do a rotation movement, but we could do just about anything with that. But we'll talk about that more later. You try that, see what kind of a result you get, and then maybe plug the other nostril and try the other one and see what kind of result. Does your brain like it? In other words, did your movement suddenly have more ease in an unexplainable fashion? Or did your brain not like it, or just really didn't care? Nothing changed, or it got worse. So if it got better, we use it. If it didn't, we just throw that one out for now.